Let's ask a man I can always depend on for a straight take on the reality and his rationale. Senator, Democrat, Pennsylvania, John Fetterman. Good to see you, sir.
Oh, thanks for having me back.
Good. Oh, you're always welcome. So, two quick things. Start with the health care because it matters most. Do you believe that the Republicans are willing to allow these to expire?
I mean, right now that's what's going to happen. I mean, Leader Thune announced that there's definitely not going to be a vote in December. You know, he described that there might be a potential path, but that's going to be in January, and I don't know how that's going to change because technically it expires at the end of the year here. So for me, I mean, I've been just consistently trying to push. Hey, you know what? They have their views. We want our 3 years extension, and that's a non-starter as well too. And what the Republicans put out last week, that was a non-starter. We didn't get a single Democrat to vote for those. I'm saying, look, we have just a couple days left before we're out. Why not just do extended for a 1 year extension? And that way we can say Merry Christmas and we deliver that and people can put their minds at ease and have that 1 more year of this. And we could spend 2026 to negotiate and make the kinds of appropriate changes to make it much more durable and extending that as well too. So for right now, as I've said last week, both proposals, the 3 year that I voted for and the Republican ones, I mean, they were essentially designed to fail. They knew they weren't going to pass. And you can't possibly make significant kinds of changes to something this complex like this. And we're out essentially 2 days out. So for me, that would be simple to do that. So that's what I've been encouraging. You know, we can work together because I think enough people on the Republican side that, you know, no one really appreciates Obamacare. You don't have to appreciate it and buy all in. You can say, we want to deliver relief for our constituents. And that's the quickest, most elegant way that has a possible of passing before the end of the year.
Where do they see the win on the right when their people are going to lose subsidies too? You know all the numbers. You know a lot of people who voted for this president need the ACA subsidies.
I mean, yeah, absolutely. It's going to impact plenty of people. I mean, I'm aware we have a little 400,000 people in my state that receive those kinds of things, and some of the highest kinds of increases are in the deepest red counties in my state. That's going to touch their own people, and that's manifold. Unpack on top of the big beautiful bill that's going to impact rural hospitals and things too. So for me, that's the quickest way. So for me, you know, we own healthcare. At this point, there's not enough time. I hope, and I don't believe that our party's just using it just for a political, you know, theater. But now we're not going to get 3 years. But I think, hey, 1 year. I think that's the one solution that can work because, you know, the Republicans, you know, want to make significant kinds of changes. And it's reasonable to make some kinds of changes, but there's not possible to do that before the end of the year at this point. And Leader Thune confirmed that. And I think Speaker Johnson effectively said the same thing over there in the House.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.